You know, for a few years, we led this show with conversations about COVID every week. It doesn't top the news as much anymore, and that's thanks to widespread availability of vaccines. It's not a huge danger to most Americans, but it never did go away, and there are vulnerable populations who remain at risk. According to the CDC, COVID cases are growing or likely growing in 20 states. Many of them are in the West and the Great Lakes region, as you can see here on the map. We're in the midst of a summer surge. That does happen every year. And we're about to be joined by one of the most effective doctors and activists during the height of the COVID crisis, and one of the most tried and true and earliest friends of this show on this issue during that scary time. Dr. Ayla Stanford founded the Black Doctors COVID-19 Consortium in 2020 as the pandemic was taking hold. Dr. Stanford, who was working as a full-time pediatric surgeon at the time, knew a crisis of this magnitude would disproportionately affect the Black and brown communities. She also recognized the vast racial injustices in the healthcare system nationwide, and more specifically in her hometown of Philadelphia. As part of her anti-COVID efforts, she, along with other physicians, provided hundreds of thousands of COVID tests. Remember the day when you couldn't get tests? To Philly residents in local parking lots. In fact, Dr. Stanford gave me my first COVID test. Her goal was to inform and protect her new patients while also treating them like family. Since then, she founded the Dr. Ayla Stanford Center for Health Equity. Her drive, her initiative, and her will to help her community earned her a position in the Biden administration, serving as the Mid-Atlantic Regional Director in the Department of Health and Human Services. Dr. Stanford discusses her remarkable journey throughout the pandemic in a brand new memoir titled Take Care of Them Like My Own: Faith, Fortitude, and a Surgeon's Fight for Health Justice, which is in stores now. It is my remarkable honor, as it always is, to have you here.
Thank you. It's nice to see you.
Let's talk about what's going on right now. There is still COVID around. There is a new vaccine that I believe is going to be available in the next week or so.
Next week or so, absolutely.
And people aren't sure. They don't know what to do. They don't keep records of it anymore. Nobody asks you for your vaccine. It just seems to be everybody I ask isn't sure. Should I get it or shouldn't I? Right. What's going on with COVID and what's going on with the vaccines?
Okay, so first thing, it's been approved by FDA. It'll be rolled out different times across the country. We are in a peak. But this is the time that we peak, okay, for a couple reasons. One, most people got their shot September, October 2023. Some people November. The shot is most effective the first 6 months. It starts to wane as you get closer to a year. That's exactly where we are right now. Everyone's been at cookouts, we've been traveling, they've been at big conferences where there's been high viral load. So that's why you're seeing the peak. And so we peak in July, and we also peak around November and December, because again, folks are coming together. And so should you get it? Should I answer that question?
Yeah.
So should you get it? Absolutely. Number one, if you are immunosuppressed, if you're vulnerable, if you're pregnant, if you have chronic health conditions, absolutely, no question. It's eligible for anyone who is 6 months and over. You should get it even if you've had COVID, because when you add the vaccine on top of it, it amplifies your protection. Now, if you had it this summer, you might want to wait 2 months, even 3 months, and maximize that sort of passive immunity just from you having had COVID. But for people who say, well, I'm young, I'm healthy, it won't be that bad. It's like getting the cold. Well, if you have the vaccine, it reduces your chances of getting it. It reduces the chance of severe disease and hospitalization. It reduces the chances of you transmitting it to someone else. And there's now data that shows it reduces long COVID. You don't want to be thinking about headaches and shortness of breath and achiness and just not being yourself for something that's now preventable.
You and I spent a lot of time, not just talking to each other, but on Facebook chats with people in the community.
Allie and Ayla.
It was fantastic. and people were, here, you were addressing a few problems. One is there was no availability of tests anyway. But number two, you were dealing with an underserved population from the perspective of healthcare. A lot of Black people in Philadelphia and in other major centers didn't have a primary care physician to start with and had comorbidities, either heart disease or suffering from diabetes or obesity. And then came with some valid concerns about the government telling you to stick something in your arm that was created at warp speed. You had to really work through that. And you were only going to do it on the ground talking to people one-on-one. Literally, I think people came to you because they trusted you.
Mm-hmm.
How's that gone?
So it has been fantastic, but we had to earn the trust.
Yeah.
I don't want anyone to think that black and brown folks, and white folks for that matter, trusted me just because I was black.
Right.
I had to earn it.
Yes.
I had to be present and proximal, provide barrier-free care, and go to the communities where people were.
Literally, you went and held these things in.
Yes, in parking lots and in parks and on street corners. And oftentimes people say, well, black and brown folks don't trust the healthcare system, but the healthcare system has been untrustworthy. It's not like they woke up one day and said, I don't think I'll trust people. No, it's because of atrocities and current day events, COVID, for example, where the resources that should have been available for the most vulnerable were not present. And that's why there was even a need for the Black Doctors COVID-19 Consortium to come into existence to take care of those who were left behind.
And you had black doctors, you had church leaders, you had celebrities in the community all coming out to help, but it was all to build trust. Is there, I mean, I guess somebody would have to do a study on this. We'd have to talk to Penn to do it. But is there some measurement that health outcomes for these people will improve by virtue of the fact that they came to trust doctors? They maybe thought, hey, maybe I'll get a doctor, maybe I'll get an annual checkup.
Oh, my goodness, absolutely. So there's one, that representation, specifically with black communities. There's evidence now that just having one black doctor in a county will improve overall health outcomes, because it's sometimes a lived experience, it's a cultural understanding, it's a perspective you can provide to your colleague that they may not have by no fault of their own. It's just a lived experience. And so having that does make a difference. It does improve health outcomes and life expectancy.
I remember a conversation with you. In fact, I think you got a little bit emotional talking about whether you should have gotten the vaccine. Your science background, the doctor in you said, of course.
Right.
But there was someone in you that said, I have some of these legitimate and valid fears that people in my community have.
Absolutely. And that feeling is passed down culturally like a recipe, for example.
Yeah.
And so I really had to separate what I had learned for years in training in medical school and in the lab versus what I felt as a black woman in America, but also recognize that I was a trusted messenger and people were looking to me for guidance.
Right.
And so what I did was much of what they followed. And I didn't take that lightly at all.
I remember that well. Ella, it's great to see you.
It's great
Thank
to see
you for
you,
all
as
that you
always.
did for us and for our viewers.
Thank you.
Dr. Ella Stanford is the founder of both the Dr. Ella Stanford Center for Health Equity and the Black Doctors COVID-19 Consortium. She's the author of the brand new book, Take Care of Them Like My Own: Faith, Fortitude, and a Surgeon's Fight for Health Justice. It's an important read, and it's an amazing story. Still ahead, the biggest post-Roe test of the popular movement